Here in this video, you will learn 6 easy steps to use your Toujeo solostar pen. Checking your pen, attaching a new needle, performing a safety test, selecting the dose, injecting your dose, removing the needle. It is important to talk to your healthcare personnel about proper way of using injection before you begin to use your pen. Be clear of all instructions before using your pen. If you are not able to follow all instructions, you may get too much or too little insulin. Step 1. Check your pen. If you are using a new Toujeo solostar pen, take it out of the refrigerator at least 1 hour before use because cold insulin can be painful when you inject. You must also check the expiry date before using the pen. Do not use the pen after expiration date. Firstly, make sure that your hands are clean and then remove the pen cap. Ensure that insulin inside the pen is clear. Do not use the pen if the insulin looks cloudy, colored, or contains particles. If you see any of these, use a new pen. Use alcohol cotton swab and wipe the rubber seal at the end of the pen. After this, you can proceed to step 2. Step 2. Attach a new needle. Before we show you how to attach the needle, there are a few things that you should always remember. Do not reuse needles. Always use a new sterile needle for injection to avoid infection and contamination. Always use needles from BD, such as BD Ultrafine, Whipsomed, such as Clickfine, or Owen Mumford, such as Unifine pen tips. For attaching a new needle, take the new needle and peel off the protective seal. Then hold the needle straight and then screw it onto the pen. You should be careful not to over-tighten it. After this, pull off the outer needle cap and keep it aside because you will need it after you have finished injecting. Then pull off the inner needle cap and throw it away. Step 3. Perform a safety test. It is important that you do a safety test before each injection to ensure that the needle and pen is working properly to deliver correct insulin dose. To start with safety test, turn the dose selector and select 3 units until the dose pointer is between 2 and 4. Then press the injection button. If the insulin comes out of the needle tip, that means the pen is working properly. If there is no insulin coming out of the needle, you may need to repeat this step again for at least 3 times with the same needle. If no insulin comes out, simply change the needle. If you have changed the needle and still insulin is not coming out of the needle tip, then do not use the pen. Use a new one. Remember, if you see air bubbles in the insulin, it is normal. It will not harm you. Step 4. Select the dose. In this step, you will learn how to select the dose. The Toujeo solostar pen contains a total of 450 units of insulin. You can select doses from 1 to 80 units in steps of 1 unit. Each pen contains more than 1 dose. While selecting the dose, you can see how many units of insulin are left. The dose window shows the amount of units selected. Even numbers are shown in line with the dose pointer and odd numbers are shown as a line between even numbers. Step 5. Inject your dose. Toujeo can be injected in 3 areas of your body. First area is the stomach area, except for a 2-inch radius around the navel. Second area is the fatty tissue on the outer back area of your upper arm. Third area is your thighs. Remember to change your injection site each time you inject. Remember some guidelines before injecting the insulin, like do not inject your insulin into a vein. Rotate your injection sites as instructed by your doctor. Never reuse needles. Do not use your pen if it is damaged or not working properly. Do not force the inject button as this may break your pen. Once you have chosen the injection site, you must use an alcohol swab and wipe the injection site. After this, you should push the needle into your skin as shown by your healthcare personnel. Now, place your thumb on the injection button and press the button and hold. Avoid pressing the thumb at an angle as it can block the turning of dose selector. When you press the injection button, hold it when you see 0 for 5 seconds, or you can just count to 5. This will ensure that full dose is administered. Then remove the needle from your skin. Step 6. Remove the needle. In this step, you will learn how to remove and dispose of used needles and then store your Toujeo solostar pen. Always remember to handle the needles carefully to prevent any injury and cross-infection. To remove the needle, you will need to grip the widest part of the outer needle cap that you had kept aside. Guide the needle straight to the outer needle cap. Push the cap firmly. Now, you should squeeze the widest part of the outer needle cap and then turn the pen several times with your other hand to remove the needle. Try again if the needle does not come out. After removing the needle carefully, always dispose it in a puncture-resistant container. Finally, put the pen cap back on, but do not store the pen back in the refrigerator. This completes the 6 steps of injecting and using the Toujeo solostar pen. Now, let's learn about storing the Toujeo solostar pen. An opened pen should be stored at room temperature below 86 degrees Fahrenheit or 30 degrees Celsius. Do not refrigerate an opened solostar pen. Keep out of direct heat and light. Do not store your pen with the needle attached. Store your pen with the pen cap on. Discard 28 days after first use. Unopened solostar pen should be kept in the refrigerator at a temperature between 36 degrees Fahrenheit and 46 degrees Fahrenheit, that is, 2 degrees Celsius and 8 degrees Celsius. Do not freeze the pen and discard the pen after expiry date. Thank you for joining us as we explained to you how to use Toujeo solostar pen and how to store it. We hope that this information was helpful. If you have any questions regarding Toujeo solostar pen and managing your diabetes, you can consult your doctor.